individuals can join us as we get going. So good morning and welcome to this Workforce Wednesday webinar. I'm Molly Cook and I'm a consultant to the Illinois Center for Specialized Professional Support. Today we have some great speakers to talk to us about individual and natural supports. A few notes about our tech setup here. All participants on this call do have the ability to unmute, but we ask that you refrain from doing so until we do the question portion, or if you have a question. And if you have questions throughout this presentation that you don't want to forget, you can always put them in the chat box and we'll be sure to address them at the end of the webinar. This webinar is recorded. The presentation and all materials will be online. I'll put the URL in the chat in just a minute. Within 48 hours, you'll be able to access this again. To be as accessible as possible, we are offering closed captioning on this webinar and on the recorded session. At the end of the webinar and tomorrow, you'll receive a follow-up email, including a survey asking you about your experience today, and also just to give us some feedback on future webinar content. So it really helps us if you're able to fill that out. Okay, I am going to go to some polling questions. So our first polling question that you'll see on your screen in just a second here, I'm going to see which one is listed first, is where is your local area? The second one you'll see is which partner do you best represent? So if you could take 20 seconds or so to fill these out so we can just see who is all here today, that would be great. All right, about 5 more seconds here. Perfect. Okay, so you should see your results on the screen, and this is great. We have folks from lots of different regions of the state and various sectors of workforce, and so we're happy to have you all here. And now I am actually going to turn it over to David Friedman to introduce our session.
Awesome. Thanks, Molly. Hello, everybody. Welcome to our webinar. Thank you for taking the time to join us today. I'm Dave Friedman. I'm the CEO and founder of Autonomy Works. Autonomy Works is a social enterprise located in the west suburbs of Chicago that employs people with autism. And I'm also, for the purposes of today, I'm the chair of the IWIB Career Pathways for Targeted Populations Disability Workgroup. The Career Pathways for Targeted Populations is a committee on the subcommittee of the IWIB. We have 3 groups focused on different targeted populations. They are opportunity youth, returning citizens, justice involved, and then people with disabilities. So this group here, this conversation today is sponsored by the group with focus on people with disabilities. And our focus as a group is to look and try to identify strategies that have been implemented in different places around the state that have helped make people with disabilities successful in the workplace, not just in finding jobs, but also importantly with being able to maintain and succeed in jobs over the long term. The committee is made up of employers, people from the workforce, state agencies, educators, sort of a mixed group of people, so that we're able to bring together different perspectives and different knowledge from around the state. And given our sort of focus on trying to eliminate barriers, we've been running, this is the third of a 3-part webinar series that we've been working on this year, trying to look at some of the key barriers, some of the things that both get in the way, but also have the potential to enable people with disabilities to be successful. So in April, we did a webinar on corporate culture. So looking at things that organizations can do to successfully change their culture so that people with disabilities can be successful. In May, we talked about universal design and accommodations. And today, we're going to talk about individualized support. All 3 of these, I think, are really important tools that the workforce system can collaborate with businesses to be able to help businesses make the changes so that they can hire people successfully. We're going to follow the same format today as we have followed in our last couple of webinars. So each panelist is going to get 5 or 10 minutes at the beginning here to share a little bit about their organization, about their perspectives, and a little bit about who they are, so that you have some idea about where people are coming from when you hear their responses to the questions. After that, we have a handful of pre-prepared questions for the panelists, and so they'll respond to those questions. And then after that, we will open up the floor for audience questions. If something occurs to you, as Molly said, during the process, as you're listening, please put it in the chat. We'll be keeping track of that, and we'll make sure that those questions get raised when we get to the audience questions part of the conversation. Great. We have actually two participants today. We have Nanette Cohen from the Dunman Opportunity Center with JCFS Chicago, and Brittany Hyde from the Annixter Center and the University of Chicago Medicine. Unfortunately, John was unable to join us today, so we had hoped he would be able to participate. But oh, John's there. And we have John from Social Kitchen, who will also be joining us to talk a little bit about his innovative social enterprise in Southern Illinois. Fantastic. Great. And so with that, John, we'll just kick it right to you to talk a little bit about Social Kitchen and what you've got going on around it.
Sounds great. Hey, good morning, everybody. My name is John Michelle. I'm the co-founder with my wife of Social Kitchen, which has been described as a unique social enterprise and hospitality incubator. I'm actually standing in one of our two restaurants right now per design for this, and I'll explain that in a bit. We have two primary focus areas here at Social Kitchen. It was founded several years ago around the growing and acute problem we have with food deserts and food insecurity, but specifically as it relates to the ability to reach people with hot, nutritious, restaurant quality meals. COVID made this quite an acute problem. We saw about 70% of the capacity across the United States for delivering hot meals essentially be to evaporate almost overnight, and that capacity has not been backfilled. You can imagine how hard it is to get consistent employees. Imagine volunteers, and some of you will appreciate that. So what we set out to do is rethink the entire way that we can organize and systematize community capacity. To that end, we do two primary things. As I said, we deliver dignified dining. What that means is through our business model, we're able to reach people anywhere that they're at. Through our large restaurant platform, we have 2 restaurants, we have a food truck park, we have 6 food trucks. And we saw food trucks as a very, very unique opportunity to reach people, distribute food in a very economical manner, very agile manner, because there is no zip code, there is no curb, there is nowhere a food truck can't get to. The other thing that's interesting about our foray in the food trucks is that has been a business that had been growing exponentially, and all COVID did was accelerate that. So we see that if you look at it from a business standpoint and a community acceptance standpoint, we're growing at hundreds of % a year across the United States. Food trucks are just now a natural part of the culture. They started kind of novel and fun and kind of cool and quirky. Now they're everywhere, and people are building capacity in cities. They're just not doing it as intentionally as perhaps we could do. So delivering dignified dining means we've created a unique program that is tokenized giving through our nonprofit that allows us to engage with nonprofit, for-profit leaders and others who want to reach at-risk groups and then be able to deliver hot restaurant quality meals. The specific token system, which you can see at currencyofcaring.com, allows whether it's an entity or whether it's individual to buy a currency at a discounted price at $8. They can either be the medium, or they can essentially provide that token back to us. We collect those on behalf of the community, and through our food trucks, our restaurant, and now we have 11 different other locations that we do this. We're in St. Louis, we're across the region, and we're growing there. We've turned on other participating partners. We can in turn then, every time we collect a certain amount of tokens, we then deliver 100 free hot restaurant quality meals to people all across the Metro East area, with the goal ultimately of systematizing this and scaling it to others across the state and ultimately the nation. The second part of our mission directly relates to this. So we started with dignified dining, give people who are struggling an opportunity to experience the free restaurant quality meals they may not afford, but in that moment, they know people care about them, and we go to their neighborhoods to do it. The second part relates to how do we train people? How can we reach at-risk groups or diverse populations of people who need a chance or want to be part of a chance of something special? And in this case, when we opened our second place here. I'm standing in it today. It's called Holy Crepes. It's a dessert ice cream parlor, crepe parlor, and it's modeled after a place my family has on the East Coast. And we intentionally then started to integrate individuals with some form of disability. We simplified the model to be able to make it not a lot of friction. A restaurant can have a lot of friction in it. So this is a reasonably frictionless place. We have great mentors and trainers, and this has allowed us. We've now also expanded the ability to hire certain folks with some developmental disabilities or other perhaps at-risk background, touched by justice, into our restaurant at Social Kitchen on the other side of the campus. And so we have seen that being in service to people on the food side of it is great. Being able to train and involve people in that process of serving us is even better. The second thing we do related to training is we create entrepreneurship opportunities. I told you we're kind of, we're pretty good at food trucks now. We didn't know anything about it 2 years ago. And being a former Air Force general, we tend to look at things from systems. And we realized that the food truck community, for all its promise, was very hyper fragmented and very disorganized. And there was no training. Food trucks in America today fail at a rate of 62% within 24 months. And that is largely because lots of people like to cook and think if they get a box with wheels, it's going to work out. But they don't understand business. They don't understand all the other things that have to go into running even a little small enterprise like a food truck. So to fill that gap, we worked with the state of Illinois and then the Department of Labor, and we created America's first food truck apprentice program. This is a program where they go through a proper curriculum. I get a lot of people on this call today. Over time, they finish the program, which involves 2,500 hours of actual practical time and classroom time, of which we administer everything. As of last October, we were fully certified by DOL now to execute the program nationally. And we then bring them through to get them a proper certification by DOL. And some of those members, we actually then choose to put into business. What I mean by that is we have spawned 3 food truck enterprises from our graduates. Holly and I end up through our business here. We end up funding their food truck business. We know they're trained. We've been with them for a while by the infrastructure, and then they move into a 5-year kind of earn to. They go out, they operate that food truck, and at the end of 5 years, if they successfully complete it, we give them the title to the truck. The goal is to promote entrepreneurship. So now that we have a training system and a platform and a currency and caring program and the ability to integrate people of all different abilities, our next step then is to see how can we regionalize this. Again, our campus is about 2.5 acres here in Swansea. Some of the people on the call have been here. It's unique because I said it's a hospitality incubator. We now have 6 different businesses operating here. We have about 30 different people, and our goal is to continue to grow it, to give everybody a chance to be part of moving in service to others in our community who are at risk, who need help, and ideally maybe even inspire others in other communities to want to adopt a similar model. So I'm really super grateful for the opportunity to be here with you all this morning, and look forward to questions, and we'll have some more conversation as we go forward. Thank you.
Great. Awesome, John. And I'm one of the people who's had the good fortune to go down and see some of the operation down there. And I do encourage anyone who gets into that area to go over and see what they've built, because it's pretty impressive and quite a good restaurant as well. Great. With that, I'm going to turn it over to Brittany Hyde. She'll introduce herself a little bit more and share some of what she's been doing with Annixter Center and the University of Chicago Medicine.
Hi there. Hopefully you can see my screen. You see a slide that says Inclusive Pathways, U Chicago Medicine?
Yep, we see it great.
Thank you so much. Okay, so hi everyone. My name is Brittany Hyde. My pronouns are she, her, and I'm going to provide a brief visual description. I'm a white woman with brown hair, green eyes, wearing glasses. Today I'm wearing a shirt that says the future is accessible. We're celebrating ADA's 33rd anniversary today. So happy anniversary to anybody celebrating today. And I'm going to talk a little bit about inclusive pathways at U Chicago Medicine, and about natural supports, which is what we're all here to speak about today. So with that, I am the natural support at U Chicago, and I'll tell you a little bit about what that means. So my title is Disability Inclusion Coordinator, and I work at Annixter Center, and Annixter Center has been around for around 100 years. It's a social impact nonprofit organization that provides services to people that are deaf, deafblind, hard of hearing. That's through our arm of Chicago Hearing Society. Additionally, we provide services to people with mental health diagnoses, as well as disabilities, other disability services. And we provide programs that help individuals thrive within their community. Today, we're coming together, like I said, to talk about natural supports for employees. So I'm going to talk to you a little bit more about how I am that throughout this presentation. But one of the ways that Annixter provides support is through employment services. My role is dedicated to employment, so I'm going to talk a little bit more about my role and its responsibilities. So listed on this screen, it's titled Disability Inclusion Coordinator, and listed are my responsibilities. So I recruit job seekers with disabilities to University of Chicago Medicine in hopes that we can make a good match for a good fit in roles that we're hiring for at the medical center. I provide subject matter expertise to the organization to better the experience of disabled employees. And then I consult on and provide professional development as it pertains to disability. In addition to the things listed here, I also sit as the co-chair for our Disability Inclusion Resource Group, which is relatively newly found. And so with kind of all of those responsibilities, I am the natural support for the business as it pertains to disability, as I am kind of the go-to subject matter expert. And just want to kind of put a call out there that I'd highly recommend that employers consider a dedicated resource in the area of disability, because even if it's not necessarily in-house, if you're going to, hire a consultant, I think it can be hugely impactful to demystifying any concerns that that the organization might have kind of around disability. And it's incredibly helpful in creating a culture of acceptance and inclusion. So if you build that culture, it will attract a whole talent pool of people that you might be otherwise missing out on. So I'll put that plug in there. To talk a little bit more about inclusive pathways, this slide here says a path to employment. I have a picture of University of Chicago Medicine, and it talks about our UChicago Medicine and Annixter's partnership. We've been partnering with them for going on 3 years to put on Inclusive Pathways, which is an initiative to support individuals with disabilities applying to any of those open positions at the medical center. So the goal of Inclusive Pathways is to eliminate any barriers that there might exist for disabled job seekers interested in opportunities at UChicago Medicine. The way we do this is through my role. So I provide one-to-one support. On this slide, it's titled One-to-One Support. There's a picture of me, and it talks about how I work one-on-one with qualified program participants. I do that by meeting with them one-to-one to determine what type of support they might want, or the type of support maybe they don't want in their journey as they're searching for roles at UChicago Medicine. I assist people from before an application sometimes is even submitted all the way through employment. So that support looks different for each person and is led by the job seeker. So this support can include, but doesn't always include, providing ideas on positions that might be a good fit. Sometimes people come to me, they know exactly the type of role they're looking for. They don't need any of my advice there. Some people are really interested in working at UChicago Medicine, but maybe didn't have a role in healthcare before. So they asked me to look at their resume and provide some ideas. Once they figure out kind of what a good fit is, or they have an idea of what track they might be on, I can answer any questions about positions that they might be interested in. I can assist them with completing the application if there is any need for that. And then I submit them to the hiring team and advocate for their application. I'm not normally part of the interview process at all. The hiring team does that separate of me completely. But if there's any access need, I'm always in communication with the applicant and can connect that information to the hiring team. And then if an applicant then becomes an employee, I can assist them with the onboarding process, the orientation process, and beyond. So as long as they are an employee at UChicago, they can reach out to me about anything at any time as it pertains to disability or not. To be eligible for this program, you mostly have to be eligible to work at UChicago. So most of that includes that you have at least a high school diploma or equivalent, you're 18 years or older, you are capable of independently completing the assigned work duties with or without the need for a reasonable accommodation. And then the last piece is that you have to identify as someone with a disability of any kind. So the ADA defines disability very broadly. That's purposeful. So anybody that has a disability of any kind can reach out and go through this program. In addition to the support that I provide, we have been able to also reach out to Annixter for if there's additional support needed, including job coaching and things of that nature. So the last kind of bit I'll give here is that this is a program for hiring for all positions across the entire UChicago umbrella. So that's University of Chicago Medicine in Hyde Park, Ingalls Memorial Hospital in Harvey, and then all of our other satellite locations throughout the city and some of the suburbs. This is not hiring for any one specific program. The whole point of the program is that we're getting qualified folks into positions that are a good fit, and just eliminating, like I said, those barriers that there might exist in between, you know, the right candidate and that open position. If anyone's interested in inclusive pathways, learning more, or you might want to refer someone to the program, my contact information is there. It's just brittany.hyde@uchicagomedicine.org. We could talk about what it means to get started, but that's kind of my spiel. Thank you so much for listening and giving me the opportunity to talk about this program, and I look forward to questions.
Awesome. Thanks, Brittany. Look forward to hearing more about this as we get into the conversation. And our last panelist is Nanette Cohen from JCFS, and I'll turn it over to her now to introduce herself and talk a little bit about JCFS.
Good morning, and thanks for the invite to speak today. I am the Senior Director of Employment Inclusion and for the Duman Opportunity Center for JCFS. JCFS strengthens the lives of children, adults, and families for now more than 160 years. The agency has a budget of about $35 million, and last year we supported more than 25,000 individuals seeking our services. Excuse me. We have 3 pillars of support. The first one is our core programming, where we have our highest or refugee services, and as you can imagine now, we're ramping up and helping many new refugees settle in the city, including employment opportunities and housing and acculturation. We also have in this pillar our core career services, which reaches out to the community and assists them at any point of their job search, as well as our access center, which is our one point of entry for anyone who's looking for services or resources within JCFS or within the community. We have a team of social workers who support individuals in that endeavor. Our second pillar is our social emotional well-being centers, which provide mental health counseling, psychological testing, child welfare services, response center for teens, our newly opening Center for Trauma and Resilience, as well as the NAP School, which is alternative programming for individuals in the surrounding school districts. And our third pillar is our disability services. We have pediatric therapies, which include PT, OT, and speech therapies. We provide those in our centers, as well as respite for parents with young children with disabilities, as well as SIP shops. We have mental health counseling for individuals with disabilities, which is really specific and a unique service. Most of the time, an individual with a disability needs to really vet their mental health counselor to see if they can understand and relate what they're going through. We have a specific program and counselors who are trained in mental health counseling for individuals with disabilities. We have many residential sites that we manage. We don't own any of the homes, but we manage them from matching roommates to supporting 24-hour care for some of the homes if that's what's needed. And then we have our employment services, which includes the Human Opportunity Center, as well as about 16 government sites where we're providing janitorial and business services. So we clean the FAA towers in all the area sites. We are cleaning the 911 centers for the state, as well as doing mental health centers, VA hospitals, things of that nature. In particular, the Human Opportunity Center serves about 400 to 500 individuals annually, 19 staff in various roles, from management to employment specialists, job coaches, business services reps support the individuals who are 16 years on up. We have two customers. We have the job seeker as well as the business, and we treat them both as customers. We want both of them to be happy, not only with our services, but with each other, so long-term supports and success can occur. All of our services are individualized, so we're really getting to know the job seeker, what they want to do, what they'd like to do, what they don't like to do, as well as their qualifications and their employment goals, not only for today, but for future years. And we'll support them in a spectrum of services that we have, from very little support to high level support, with supported employment and with customized employment. All of the staff of the Human Opportunity Center are trained in customized employment, and we use all the strategies of customized employment in all aspects of our services, even if the individual isn't getting true customized employment services, but our strategies and methods are based on that. In last fiscal year, which was right now, all the data I have is for FY22, we placed 144 individuals into competitive integrated employment with 90-day retention at 80% and 1-year retention at 30%, with an average time for placement of 7.5 months. As you see, in the next 6 months, COVID had an effect on the retention and the length of services. In the first half of this of last fiscal year, we placed 87 individuals. 81% had the 90-day retention, which is similar to the previous years, but the 1-year retention increased to 53%, and the average length of time from placement went down to 4.5%. So we are coming out of COVID. We are almost, I anticipate that FY23 will end at pre-COVID rates, which is exciting and wonderful that that is behind us. I mentioned the other customer that we have are the businesses. We have already established relationships with many local businesses that turn to us for their hiring needs, for their support and guidance with hiring people with disabilities, but we're always looking for additional employers that match the current job seekers that we now have. So we're always reaching out to them, always developing not only relationships for that immediate hire, but long-term relationships and partnerships that can help in other ways in the future. As I mentioned earlier, we want both of the customers, the job seeker and the employer, to be happy with the services and to show that we will be matching appropriately and really reaching out to the businesses as well as the job seekers to really find out what they are good at and what they'd like to do. We're finding that most of the job seekers that are placed can help businesses increase their bottom line. And we are also beginning a formal partnerships with other providers to help our businesses fulfill their needs with individuals with disabilities without really getting any credit for that, but just the credit of having the businesses happy with our services. So that's how much we want each partner to be happy with what we're providing. That is it in a nutshell. I know that was a lot of information in a very short period of time. JCFS is a huge organization and it's hard to get it fit into 5 or 10 minutes. So I hope I did adjust.
Great, awesome. John, Brittany, Nanette, thank you for that overview. So now I think everybody on the call here should have some view of the context of the people that the panelists and a little bit starter information. So now we're going to try to get a little bit more specific, because I know we often hear that it's very helpful to have stories and real examples to help people sort of sink into the totally understand the concept. So our first panelist question relates to that, which is asking each of our panelists to share a success story of an individual or a program where they have been able to successfully create jobs and support to make someone with a disability successful. So if I just go through the group at the same direction we did. So John, you want to start and talk a little bit about a success story that you've seen through Social Kitchen?
Sure, thank you. Yeah, so our first foray into, once we expanded into our objective of hiring individuals with disabilities, was a young lady being raised by a single dad, and she had never experienced the workforce. She was just finishing up high school, and so we were fortunate to be able to work very closely, and we have an amazing relationship. I can't say enough good things about our team here in St. Clair County. He, Reese, and his entire group of individuals, whether it's on our youth program, which we employ, or under our apprentice program. We were able to get this young lady qualified in the program under OJT. We were able to start her as a hostess in the front. And over the course of time, as we basically mentored her and her just being in that particular environment, we were fortunate that we've surrounded ourselves with individuals who understand sometimes the need for a little more patience, perhaps a little more description in the things that are expected. We watched this young lady blossom extraordinarily. Now, matter of fact, she's a year into the program. She works both at our restaurant and she works now at Holy Crepes, where she is actually training other individuals on the bubble waffle station. So we've given her increasing responsibilities. People continue to invest in her. She now texts routinely the whole team when she's on vacation or something, or so she truly feels like she's part of something special. She's embraced the mission completely that we do here in delivering dignified dining and giving people opportunities to be blessed through food and through connection. And she's now an absolutely bright spot on this particular campus. We've subsequently followed with some other individuals, but she was the first. And it was it's been an amazing experience to see her grow and become much more self-confident, much more expressive. We routinely get ideas for improvement for our operation from her. And I think it's an exact example of no matter what environment we put somebody in, if we give them a chance, we help them, we train them, we include them, we listen to their voice, we routinely remind them that they matter and they can see what that looks like. That's what these programs are about and why they're so vital. So, and we've seen that in our subsequent cases, but she's certainly the one that brings a particular smile to my face because she was the first. We were uncertain on both sides of how that would work, and she's proven that it can work marvelously. Thank you.
Thanks, John. I have just a follow-up question on that. Have you, was it easier for someone with subsequent employees that the team had learned more about how to provide those supports, and was it easier for them to support new people with disabilities as they joined after her? She kind of did she kind of break the ice and kind of not just train her, but also train the other workers in the location about how to work with people better?
Yeah, that's a great question. And so, yeah, we can't just rely on an individual. We, from the outset, We always, our intention had always been to start with dignified dining and then work my way, work our way into what we call dignity through work. And that's what Holy Crepes represents here, is dignity through work. And so we had individuals who knew this would be a natural extension. So they were kind of primed on our team. And then when it was time to actually integrate Billie Jean and some of the other individuals we subsequently brought on, and we also bring in some at-risk youth that have been touched by justice and under 18 years old. We bring in individuals who've been touched by justice and coming out of the prison system to use in the kitchen. So the point is, she was kind of the first that we brought in. And we did train the team. So we had primed them as to our mission. We said, this is what we need to be a little more patient. This is in this particular case, she has high functioning autism. This is what an individual with autism, some of the things that are natural strengths, some of the things that potentially can put them in a position where they might become uncomfortable. And the team, what I found with just a little bit of awareness and a little bit of insight, took that and took it upon themselves to, in many cases, I've watched many people be much more patient than I see them with other individuals on the team. And it took that priming. So making it a priority to prime your team, we don't have to give them PhDs in the topic. We just have to let them know. And I think when it's linked back to, they see this is a very human opportunity to give someone a chance to know that they matter and that they can fit into something where they're valued. The rest of it took care of itself. We don't brief anyone. Now we just say we're bringing on another teammate. This is their particular background and one of the areas that they might have a disability. And now the team is very, very comfortable and they self-organize around the person. And they almost make it a priority to make sure that the person has been put into conditions to succeed.
Great, awesome. Thanks, John. Turn now to Brittany in response to the question.
Sure, I would be happy to share a success story. I'll talk about somebody who's, not that I want to paint disability in a negative light, but it is oftentimes a barrier, especially to employment. But it might not be the only barrier. Sometimes people are coming from a place of intersectionality, and to kind of talk about, kind of go off of a little bit what John was talking about too, is that this individual that I'm speaking with had justice involvement as well as a disability, and had been in a situation where she had continued to apply to places, but her justice involvement, when they would do a background check, a job offer was no longer extended. So University of Chicago Medicine does not discriminate against people with justice involvement. There for safety reasons are certain stipulations around that, but at the same time, the HR office benefits from the proper documentation and things of that nature to explain that this person has justice involvement, but also is okay to work in a healthcare system. And as long as that's all, those ducks are in a row, there's no issue. So we were able to partner with another local organization, Safer Foundation, that helped. I am not a subject matter expert around justice involvement and getting those ducks in a row. So she has been able to assist us. Safer Foundation has been able to assist us in those situations. And this individual who had quite a hard time she started as a housekeeping assistant and moved into, she finished some coursework that she was doing also through Safer Foundation. So now she's a CNA, and she's currently going through programming that U Chicago offers to provide assistance for her to become an RN. So she is going to school for that as well. So just the natural support being, I'm going to, that there's a dedicated resource here. There was somebody who had a few different barriers, and if there wasn't that dedicated resource to reach out to all of those people, we maybe wouldn't have had this same outcome. So something to share there.
Yeah, that's awesome, Brittany. And I two observations from that. One is I really like the idea of bringing in other partners to help where you need to. I think it's a big part of why we run these webinars, is to start to let people see different partners. And the second thing is we talk a lot about career pathways and sort of this idea of on-ramps into long-term sustainable careers. And this it sounds like a great example. I started as a housekeeping assistant, move up to a CNA, and now preparing to be an RN. That's exactly the kinds of things that we're hoping to build in these career pathways, where people can build on skills and build on their talents over time, even though they might enter with a lot of other sort of challenges to success. So they get paid, they build skills, and they get to advance. So that's really what I think we like to see. So that's awesome. Nanette, you share a case study or example?
Yeah, thank you. So in the customized employment process, we start sometimes with the employer. So myself and a colleague went on a tour of a school, of an after school religious school program. And so we toured many of the classrooms and noticed that there was a lot of disorganization. The books were not shelved properly. The supplies that the students and the teachers were using were all over the place. And it wasn't just in one room, it was in many rooms. We had a job seeker who was in her 40s, who had never had competitive employment before. She was in a workshop situation for her adult life. And so she was looking for a part-time job. And this individual loved to organize, keep things orderly. So we facilitated a meeting with the job seeker and the employer, and really created a position for her to do this. And again, without us as a natural support to do that, I don't think that first of all, the employer didn't post a job. And second of all, I don't think this individual could have articulated what type of work that they wanted to do. So fast forward, that was 11 years ago, and she's still working there with additional responsibilities. She now does some collection of some donations, and she is part of the team. She is integrated into that school environment. The students know her, the staff know her. We did provide some job coaching for a little bit when she was first hired to help her adjust to the social aspects of a job too, because it was so different than her workshop setting where she had been with these people for years. Now she's going into a new social setting. So it was more of that social setting and that interaction and bringing the new staff into her life. Like I said, she's been wonderful. She's been there for almost a dozen years now.
Oh, yeah, that's a great story. Two observations on that. One is, it's a big priority, obviously, to start to move people from workshops into more integrated employment. And so that's great success story to see how you were able to do that. And also, I think that it's important to remember that job coaching can be an important bridge for people in terms of building those supports on the employer side. So it's not like there just have to be natural supports. There can actually be job coaching that can kind of help with that transition and help move people into those supports and build those for them.
Yeah, that's one of the priorities of the job coach. As soon as we go into coach, we develop a fading plan. So everybody, the new employee, the employer, and us, we know what the plan is and what the goals are, so we can be out of the environment so they can facilitate those natural supports that we're putting into place.
Great. Well, we're going to roll now into the next question. And why don't you continue here to talk a little bit about one of the advantages you hear is about how supports can help all employees, and talk a little bit about where you've seen that in your perspective on that as well.
Yeah, so as I mentioned, job coaching, one of the priorities is developing those natural supports. So we're looking for champions, we're looking for coworkers, supervisors that we can bring into the everyday work life of that new employee, whether it's just to ask them the questions. A lot of times when we're out coaching, the new employee will ask us a question. And instead of answering that question, we're facilitating them finding somebody within the environment to answer those questions so they get familiar and understand that. Some of the benefits, once the job coach is there too, and some of the things that we've seen are pictorial of the tasks that need to be done. This is a benefit not only for the individual with a disability, but we've seen it in environments where there are workers where English is not their first language. And so they then look at the task board. So they're developing a community amongst the coworkers on, oh, this is what we do, and showing them the task list there. We also have had people who we've provided a larger digital clock so they don't always have to look at their phone for the time, which helps everybody increase their production rate instead of pulling out a phone to say, oh, it's time for a break. The clock is right there. So it helps everybody in the environment. More production increases the employer's bottom line. More product is produced, more product is distributed, more customers are being seen. We have developed some boards for individuals who are folding clothing in stores, and now that's used by all the staff because it's easier to do, and so they can do more. So there's a lot of different ways that these supports that we're putting in can benefit all the employees of the department or the employer themselves.
It's interesting. I think a lot of those had to do with communications. So sort of manager worker communication. So, everything from, what are the tasks? What's the time? All of those things. I think lots of companies would be better if they communicated better with their employees. And if this puts some of that structure in place, I think it's probably very helpful for a lot of them.
Yeah, and speaking of communication, if for somebody who's deaf and hard of hearing to be more included into the environment, a lot of times employers can't afford, or there is no interpreter around at the particular moment that you want to communicate with someone who's deaf or hard of hearing. There are several apps that one could have on their own phone that can facilitate communication and brings everybody into the conversation.
Great. Thanks, Annette. Turning to the next question, both Annette and Brittany talked about the importance of collaborating with the employers. And John, if you could talk a little bit about, from your perspective, as a business owner and a business creator, what are the barriers for you in terms of creating supports, and then how can the workforce system broadly, I know you've worked with Lee and others, like what have they done and what can they do to help you successfully sort of build and maintain supports for people?
Yeah, no, again, another great question. And this one, actually, I don't think the answer will probably not be a surprise to many here. Now, I will tell you that from what I've seen in my experience, the individuals that work on the county side and the state side always go above and beyond. But the same thing that it becomes my greatest challenge is their greatest challenge. And that is just the inherent bureaucracy and the sheer amount of time and paperwork that it takes to be able to affect these. Now, again, I am sensitive to the fact that here we're talking about government resources, and I understand that there's a number of stipulations and proper controls we want to put into place. But I would tell you, we probably spend an equal amount of time in terms of just the recruiting is recruiting. And so that's a bit of a challenge, but that's just more about, working through and tapping into the right audience. And through certain relationships, that's pretty easy to manage because there's a lot of individuals, a lot of them on this call that exist to be able to say, I've got a qualified population. They're just looking for outlets. So the biggest problem is the sheer amount of paperwork, the sheer amount of time that we actually spend on one person. I would tell you it probably takes 12 hours of meetings and other elements. I mean, that's pretty significant when you're running a business. And again, on our end, and we have mechanisms on the county side. And the county side, actually, I would tell you, what I would like to see is the barriers reduced and increasing empowerment on their side. It doesn't need to be on our side because they go above and beyond. But the amount of hoops and the amount of, with the limited resources they have, what I have witnessed is one of the biggest limits to be able to get people integrated in these programs is that the individuals that exist to do this, and I'll just say in our case, it's Lee and his magnificent team in St. Clair County, they can only do so much. And when they have a lot of barriers in terms of requirements. So in an ideal world, and again, I'm a former senior military officer, I understand how paper trails for money work and I respect them, but to a point. And if we could find ways that, as dollars are allocated and they're given to responsible agents at the counties or individual organizations who act as agents of those who are distributing or making those dollars available, we need to empower the men and women on the front lines with a lot less bureaucracy because they're passionate about their job, but they're also frustrated about it. They're frustrated because they can't have the impact. So that's not a problem we're going to solve here today, but I think this is one of awareness. And I know politicians and others in power, there are ways to create streamlined opportunities for empowered people in the counties and in the businesses to be able to get at this. So I think, averaging 12 hours a person on the paperwork side and the individual interviewing side, I think if we could make a dent in that, I do think that alone would create more, not just more of an incentive, but it would allow us collectively to get more people into the workforce sooner that want to be there and participate.
Right, because as a small business owner too, I mean, that discourages people from, going into the system. And I know at Autonomy Works, we have sometimes made a choice just to hire someone independent of the state system because we needed the person quickly and they were ready to go, and we didn't want to take the time to go through the paperwork. So
exactly,
for sure.
As individuals who are, on the verge of homelessness, and what I mean like that. So not just disability, but we bring at risk youth, homeless youth, other things. We got a lot of success stories there, but it's just some of the requirements. There's not as much fluidity. So asking someone who basically lives on someone's couch and to bring a birth certificate. So I just think that looking at the process, looking with the min qualification and giving and empowering individuals at the level that have committed themselves to serving other people, we really, really hopefully can make this a priority. Because I mean, I feel for them and they're passionate, but every day I get to see the frustration in their eyes, as some of you do too.
Yeah, Brittany, I know you work directly with a larger company. So, John's a small company, we're a small company, but you work with a very big organization. Can you talk a little bit about, both broadly, how to help businesses, integrate people on some of the barriers they feel, and then sort of specifically, actually, the next question about how the Human Resources Department can be more supportive. So both generally, sort of, and then specifically.
Yeah, sure. I think kind of to, touch on the question that John was speaking of as it pertains to a larger organization, is that I think that employers, generally speaking, have concerns around disability, concerns around issues around disability. It's there's a lack of understanding. We have all determined that DEI is important, that diversity is important in our workforce, but we haven't quite figured out how to include disability within diversity, and it's oftentimes left out. More and more larger organizations are doing DEIA practices, A standing for accessibility. So it is, we're starting the ball rolling a little bit, but I think I will just kind of keep ringing this bell of having a dedicated resource is really very valuable, because the concerns are real concerns. Employees are concerned around, legal concerns. They have this perception of like a person with a disability also must come with an accommodation. Accommodations are expensive. What will this mean for the organization? And to touch on some of those things, a lot of people with disabilities don't need any accommodations at all. A lot of accommodations don't cost anything. And I think the average accommodation cost of those that do cost something is $500 one time. So it's but unless you have someone that's a subject matter expert, maybe you don't have those things just kind of in the back of your brain, and they're barriers for you to move forward in including people with disabilities. The other thing that I'll mention on here is 1 in 4 people who have a disability. There are already people in your workforce that have a disability, right? So whether or not that is disclosed, you might not have a culture of inclusion for those individuals currently working there. And the experience for those employees would be so much better if they could come as their full self and ask for the things that they need to be successful at work. And maybe that isn't anything. Maybe it's just that people know that I have something else going on, because for some people, it's a huge part of them and their kind of identity. So that's one piece. But as far as what human resources can do to support individuals is, they can kind of consider these best practices under universal design. So there was mention of universal design a little bit ago, and that just being the concept that we are going to set up a work environment, set up a meeting, in a way so that everyone can access it. There might not be a need for an additional accommodation. I'm not saying that if we set up universal design, we're going to get rid of accommodations altogether, but it inherently makes the space a little bit more accessible. So setting up the work environment, maybe considering work flexibility, different seating arrangements just for everybody. It's, a way for you to understand what your workforce might be interested in by way of support could be adding disability to your workplace survey. The people that you currently have working there, they don't have to identify as disabled in the survey, but you can ask questions around disability, and that can inform, the kind of things that you can do moving forward. But outside of kind of making the environment inherently accessible, making sure that the process for accommodations is clear to all employees. Sometimes people acquire a disability after they've already been employed. So now what do they do? If it's hard to find that information, it's going to be hard to ask for the things that they need. But also making sure that managers know and understand the process for requesting accommodation, maybe even give them tips for how to respond if someone comes to them asking for such a support. But then I would also just say, like, providing professional development opportunities, because this is, this is our world, but it's not everybody else's whole world. And so providing some professional development opportunities, I think, can be helpful, and maybe thinking about that strategically and targeting specific people, maybe providing lunch, those types of things.
John, I'd like to add that I think something that we all do, and we all do it probably in different varying degrees, is educating the businesses, the HR managers, the diversity managers, because as Brittany said, diversity and disability don't go hand in hand all the time. And so whether it's informal education, one-on-one, or an entire department or the business, but provide information about how to be more inclusive. I think that's part of what we're see as our job now as well.
Right. In some organizations, they have a culture already. They're already doing that, but a lot of organizations need to learn, reduce the fear and reduce some of the concerns about it as well. And education is a big part of that. Mm-hmm. Yeah. Great. Great. So next I'd like to ask me a question, which is the idea of how should individuals advocate for the support they need? To me, I think we employ a lot of people with disabilities at Autonomy Works, and I think too often the conversation around supports is deficit based. So it focuses on things that people can't do. And I think it's very important that when individuals advocate for support, they advocate in the sense of maximizing their achievement and their ability to succeed, which is a much more constructive conversation to have with HR people or organizations. And that's sort of a disability independent thing. Every manager should be talking to their employees about what that employee needs in order to be most successful. And people with disabilities are no different. And I think advocating needs to be discussed with managers in that context, so that managers perhaps see a bit more of a advantage to the goals and objectives of their department by providing these supports, rather than talking about it in a deficit way, which is sort of less constructive and less possibility oriented. Great. So with that, Bridget's not here. Do you want to comment on replication and moving programs elsewhere?
Yes, I can do that. So I'll start with just kind of stating that replication of similar programs like Inclusive Pathways that we had really has to start from leadership. You have to have buy-in from leadership in a large organization, especially. Initiatives like this one, the support has to come from the top, because that is, if you're in a space where you didn't previously have initiatives towards specifically disability inclusion, you'd hope that everybody sees it as a positive thing, but there might be a lot of people that say that that's something they're interested in, but don't really know how to walk that walk. And so there needs to be support, there needs to be communication from the top. And then from there, I would identify a dedicated disability resource, whether that's hiring someone or, reaching out to community organizations that specifically work with people who have disabilities or are subject matter experts and can help consult on these types of initiatives. But if you do hire someone, in-house, or even if you're collaborating with, you're working with a consultant, I would collaborate. So please reach out to me. I'd be happy to talk to you about the trials and tribulations that we had. We're going on 3 years, but there are other people doing similar work, but it's always good to hear from the people that have kind of gone through it about things that worked and things that didn't. So be happy to reach out.
Great. Nanette and John, do you have anything to add in terms of, do you think about some of the programs that you've been part of that have been most successful, what it would take to replicate those more broadly?
Yeah, I think, matter of fact, everything we've done, albeit not perfectly, but from the beginning, was for scalability, because again, our goal was to demonstrate a model that can be easily adopted. So our tokenized system can be easily adoptable. We've designed it so we need one responsible agent in a community, usually in the food and the hospitality business. From there, because you don't even need food trucks, quite honestly, you can affect this in the community, their model. So there's that part of it. The food truck apprentice program is a DOL certified program that now is accessible to people with the full curriculum we've already developed now. So I would say all elements are. And again, one of our objectives is going to be how we can demonstrate this at a regional level, so that in time, I will tell you now, we already have communities, other communities. So we've extended this into military bases. We've just finished the pilot at Scott Air Force Base of the same concept. It has actually been very successful. And as of yesterday, we're in conversations with individuals in California about possibly doing a proof of concept there in another community. So our goal is, it's worth doing if others can basically learn how to do it with little friction, little to no cost, and just a lot of passion for making a positive difference in their community using food.
Yeah, I would say start out small. Most of what we're doing came from a national program or another local program within the area, or individuals have replicated what we are doing, but they start out small, and we've started out small and work out the kinks and then grow from there. Probably the hardest thing is to secure funding, which is hard all the time. And so if you can find that right funder that can support you for a year, 2, 3, that's allows you to give you time to ramp up and get things going. But you need to have dedicated staff. I don't think this is a portion of somebody else's job to start a new program.
Great. Thank you, everybody. That was the last sort of pre-planned question we have. So we'll turn now to audience questions. And actually, Nanette, you sort of set up, we had one come in the Q&A, and I think you sort of set it up nicely there, which is, the question is from Jennifer Miller. Can we hear a bit more about how these programs are funded? So clearly that's important. Annette, why don't you continue on that, and then Brittany and John can answer as well.
Sure. So for the Duman Center, we have state funding through VR and IDHS, as well as we do private pay for a small group of individuals where they actually pay us privately. We also get foundation dollars as well as private donor dollars.
We talk a lot about braided funding, and I think that's an exact example of it. It's this and this and this and this and this, and together it's enough to make everything work together.
Right.
Great.
Yeah. Some funding will not support, let's say, job coaching. Others will. So we'll maneuver them through the funding streams for the services that they need at that time.
Great. Brittany?
Sure. Yeah. Thanks for asking this question, because it's information that I left out. It's easy for me to say hire someone and not explain how that was funded. But I will say that the Inclusive Pathways specifically started as a grant funded project. So it was funded by the Kessler Foundation. And so Kessler Foundation paid for my salary and for all things inclusive pathways to make it run. And within the grant, it was part of the project that if at the end of that grant period, the hospital wanted to continue the partnership and the work, that they could do that, but outside of Kessler's dollars. So I think it's really helpful to get into an organization. If you're working with Annixter is working with a lot of different community partners. If you're working with a community partner that's really interested, and has someone that feels like they have the buy-in, but they need to find out how they're going to pay for it to prove that that it is as important as it is, that could be a really good route. That's what worked for us. And the grant has since ended. It's been done since April of 2022. And UCM has continued the work since then. So if you can kind of come and show up during a pre-funded period, that could be really impactful.
It's similar to what Nanette was talking about, but sort of startup capital, like get some money to sort of prove the concept, build some of the systems.
Yep, exactly.
John, talk a little bit about how your program is funded.
Yeah, well, you're looking at it. Holly, my wife and I initially funded this. So it's been pretty capital intensive. Unlike the really good sound advice we heard from one of our team panelists earlier, we actually started big instead of small. So we've actually kind of reinventing it. But the reality is we have been successful when it comes to the extension into specific training programs and apprentice programs, and tapping into some funding for OJT, for the youth program. So these are all at the local county level. We just recently were able to, after about 9-10 months and the persistence of our team here in St. Clair County, we're able to work with Julio and the state and to get a grant to add 14 apprentices. So that part of the program itself, the part that it comes to from the currency of caring, we both have a for-profit and a nonprofit. Those are all, again, privately, they're all funded by us and or the business now. The business was built to become a self-sustaining enterprise. But that said, scalability for us, we're in the stage now, as we've heard, to be able to find and access. There's no lack of resources of getting at community food insecurity. For us, it's just navigating the process of being able to qualify for that, understand where that's at. And that's the next step, because what's really capital intensive for us outside of, we built this enterprise, is there is a lot of interest for our apprentices to grow into their own business. And that business in this case is the form of a food truck. It's a small business. It allows them to operate with some guardrails, allows them to build a better life. So that's our next priority, is whether through a foundation or through some form of a grant, to be able to find a way to reduce some of the capital requirements to extend the opportunities from training people. Some others who have gone through this program, some homeless youth, we actually have a waiting list right now of individuals, some who have graduated from the program, to move into an extension of their own business. And so I need to learn a lot more about how to access foundation dollars or private dollars so that we can scale the business. So we've just kind of took the leap off the deep end, and now we're working to be able to see if we can tap into the host of very generous resources that are out there.
Yeah, but it's the point about startup capital. You need startup capital to get the whole thing going. Individuals who want to start their food truck business need startup capital to get them going. So there's a whole theme, I think, here about the importance of having money to jumpstart some of these things. And I know I'll speak from a time course, it was the same thing. Like, we needed capital to get jumpstarted. Now it's a business that's self-sustaining, but the first 5 years were not. And if we hadn't had capital to be able to work through as we built the system, we wouldn't have gotten to the point now where it could sustain itself on its own.
Exactly right. Put that in tangible dollars. Every food truck. So again, we've launched 3 folks into the food truck business who've gone through our program. So what that means, again, is they run their business and they're kind of they have a platform with support, but that runs us probably $50,000 to $60,000 a truck to be able to get them. So there's no capital requirements for our participants. We actually pay them while they're going through the program as employees. That's what's really unique here. It's a sweat equity program where you do the work, we train you, we include you as part of a team, so you can make a living. But this gives them an opportunity to make, to move into something. And we know, on top of the food insecurity issues, we lost millions of small businesses in America during COVID. So that's why we're particularly, fascinated by this, is because not only can we serve at-risk populations or, populations who have barriers to hiring, more importantly, we can also concurrently spawn small businesses, which I still believe are the backbone of America. And so aligning those funding streams, you're exactly right, is a priority so that we can scale that and give more people that opportunity to make a better life for themselves in the long term.
Great. From the audience, any other questions from the audience? You can raise your hand. You can type into the Q&A or into the chat. I don't see anything else immediately.
There was a question from back earlier that was just, what does JCFS stand for?
Okay, JCFS Chicago used to be called Jewish Child and Family Services. We just got with the times and went with the acronyms like everybody else. But we're nonprofit, non-sectarian agency, so we serve anybody.
And been around for a long time. How long has it been?
160 years.
Yeah, it's an institution around Chicago for sure. Great. Not seeing any other questions. I'll just open up to the panelists one last time. If you have some sort of final comments you'd like to share, sort of reflecting on the conversation we've had, certainly want to give you that opportunity. Jump in.
I can jump in. Something that I kind of didn't touch too much on today, but it does in its own way provide natural supports to employees with disabilities is UChicago and other organizations have an employee resource group that is specific to disability. And so in a space where, even if you are working in a space where the organization says that they are inclusive and trying to create this culture of feeling free to come as your full self, I think that the ERG or BRG experience can be kind of that next level, because it's easier when you're in community with other people sometimes to show up as your full self. We've specifically have had some really great deep conversations around disability as our own lived experience, or otherwise, and it's really helpful to have a corner or space in work that you can show up as your full self, even if you might not be doing that in all areas of in your immediate office or something like that, for example.
Yeah, fantastic. Yeah, I was seeing a lot more of our clients with employee resource groups around this, because it's not just people with disabilities in a lot of these organizations. It's caregivers and other people that have lives that are intertwined with people with disabilities. So
yep. Yeah, and it's it's a minority group that intersects all other minority groups. So there's a lot to hash out sometimes, and so it's helpful to have that space to do that.
Great. Annette, John, anything to add?
I just want to end by once again getting a shout out to I think of every single person here, and I mean I'm in St. Clair County all the way up to the state that have literally gone the second mile every single day. I've never seen a group of individuals where they will literally come to our restaurant, they will go to people's places. So they extend so far beyond their job descriptions that I cannot tell you how indebted I am to them. And I know I speak for all those. So, and I believe and I hope that that's what all the individuals here who are in different counties experience. So I just want to really thank all those individuals that every day work on behalf of the counties and the state and others to try to extend these opportunities, whether it's through employers or through private organizations. I've been blown away by the quality and the commitment, and I just really want to shout out to every one of them and say thank you very much for what you do for everyone every day.
I echo that, John. I also want to say that in order to be successful, I think it's the relationship development and the maintaining of those relationships, that whether you're looking for funding or whether you're trying to get a new business into your repertoire for job seekers, or whether you want to escalate that relationship to another level, it's all about relationship building and the communication that you have. It's providing excellent customer service is what you need to do every day.
Fantastic. Yeah, thank you to the participants. This was great. I really enjoyed the conversation, learned a lot. I'm sure everybody did. Molly, you want to wrap us up?
Yeah, I'd love to. So in terms of next steps, you should, if you look in the chat, there is a link to a survey to complete. And I'm going to just copy and paste it in here one more time. So here's a link to a survey to talk about your experience so we can learn how to continue these webinars in the best way possible. And so if you could complete that, you'll also receive an email with that information in the next 48 hours. You'll receive an email with the recording and all of the materials from this webinar as well. And then, of course, we would love to see you on future workforce webinars. We do these every Wednesday. Other than that, we are at the end of our time together. So we're just really grateful for all of the panelists, and you'll receive a follow-up email with the survey again and materials. So look for that in the next couple days. Thank you,
Awesome.
everyone.
Great. Thanks, everybody.
Thanks, Molly,
Yep, bye-bye.
buddy. Have a blessed day.
Bye-bye.
Thanks all.